I'm Leah from Wesely Thomas out here at St. John's Regional Medical Center in Oxnard. This is the final phase of our ED NICU LDR expansion project. The area I'm going to show you today is the labor and delivery. One of the unique benefits of this project was this new external entry for laboring moms. The current procedure is the moms would come in and they would either have to go through the main hospital lobby entrance, or after hours they would go through the emergency department. So it's a great benefit for them to have their own dedicated entrance for them to come into the hospital. So if you want to come on in, I'll show you the space. This is the new waiting area. It's much more expanded, lots more seating, dedicated restrooms, and a dedicated reception desk for patient check-in. So directly off the waiting room, we have our new triage rooms. There's 3 new triage rooms. This is triage room 3. Coming along the hallway here leads us into triage rooms 1 and 2, as well as a new satellite nurse workstation. There's a couple workstations here for nurses, as well as access to the security cameras and the infant abduction alarm system, as well as a vitals alcove for general patient care. Take a peek in here, triage room 2. You can see there is a private room, single bed with all of the monitoring equipment for the laboring mother. The rooms have a shared restroom between the 2 rooms. So leading into triage room 1, again, private bed monitoring equipment for everything that they need as far as patient care. It's also right off of the nurse workstation, so they can monitor patients fairly easily. With this phase of the project, we had unique challenges that we had to overcome. On this side of our construction is mothers with new infants. On this side of our construction was mothers in labor. And so we had to really be on our top of our game as far as infection control and noise. Obviously, we don't want to upset any new moms. The entire labor and delivery space is above the kitchen, cafeteria, and dishwashing area. So in order for us to rough in all of our plumbing for the space, we had to coordinate with them as far as hours of operation, when they're washing dishes, when they're cooking food, and again, high level of infection control, working above the hard lid ceilings to rough in all of the plumbing for this space. So that was a unique challenge for this phase of the project. So continuing on over here, we have a storage room, nice big space for them to store all of their materials, as well as a staff lounge. So this is a nice big area for them to store all of their personal belongings, lunches, seating area, nice rest space for the nurses and staff, as well as locker rooms and additional restrooms. So one of the benefits of this space was a lot of added restrooms for staff and patients. Another unique challenge to this space was the addition of cutoff valves for the med gas. That required us to do a full hospital shutdown of med gas and vacuum. We had to coordinate with the hospital to backfeed areas of the hospital that required emergency med gas as well as vacuum during the time that we put in these valves. Coming out of our construction space leads into the main part of the hospital. This is the existing labor and delivery department, which will roll right into our new labor and delivery rooms. We constructed 4 new labor and delivery rooms. All the rooms are identical in size. As you can see, it's a much larger, expansive space than the existing labor and delivery rooms. This restroom, as well as the one across the hall, have showers for patient use. In the hallway here, there are nurse alcoves where nurses can monitor patients through the windows, as well as have access to the security footage and the infant abduction alarm system. These two rooms here have dedicated restrooms again. These two rooms have the benefit of an added bathtub, as well as all of the labor and delivery rooms have the new high-tech birthing lights. So on behalf of the Wesely Thomas team, I'd like to thank Dignity Health for the opportunity to work on this multi-phase project, which included the ED addition, the renovation of the existing emergency department, as well as the new neonatal intensive care unit, and now this final phase of the labor and delivery project.